One moment, my computer just froze.
Okay, you just go ahead when you're ready, okay, Stacy?
Okay.
Are you ready now, Stacy?
Yes. Ladies and gentlemen, welcome to the LA County COVID-19 update conference call. At this time, all participants are in a listen-only mode. Later, we will conduct a question and answer session. Instructions will be given at that time. If you should require assistance during the call, please press star, then 0. I'd now like to turn the conference over to Supervisor Catherine Barger. Please go ahead.
Thank you. Good afternoon. I'm Supervisor Catherine Barger, Chair of the Los Angeles County Board of Supervisors. Thank you for joining us today. In addition to the daily case count from Department of Public Health Director Dr. Barbara Ferrer, we will also discuss protection of our first responders and our efforts to expand testing. Dr. Clayton Kazan will address the many ways the county has been working with public and private sector partners, along with our 88 cities, to increase testing for our healthcare workers, first responders, and for the public. The Department of Health Services will also begin testing county patients this week. We are exploring every avenue and tapping all resources to adequately meet the needs of each of Los Angeles County's residents. I'm proud that our office has worked with the High Desert Medical Group and the City of Lancaster to ensure testing up in the Antelope Valley. It's important that we reach all parts of Los Angeles County. Slowing the spread of COVID-19 really does take each of our communities doing their part. As a reminder, please maintain social distancing. It is the surest way to flatten this curve. We are in this together, protecting our health of all our residents. And now I would like to invite Supervisor Hilda Solis, Chair Pro Tem, to say a few words. Thank you.
Thank you, Chairwoman Barger. It's a pleasure to be here and to join you today. I want to take a moment, however, and thank everybody for doing their part. Helping yourself, your family, your friends, your neighbors means staying home and participating in practicing physical distancing. Also, I want to say that just because you're home doesn't mean that you can't pick up things and maybe start a new little trend or a hobby. Just like these East LA seniors are doing by making their own masks and sharing them with our community. These are things that are acts of kindness that can be done easily and anywhere. And I want to thank those seniors that did this and provided that for many staff that work for LA County. But you know, we still have to remember, it's about bending that curve. And it means that we have to provide all the necessary support and guidance so that people are adhering to that. It is very critical that people practice physical distancing. I also want to touch on a subject that's very sensitive, but one that has to be brought out. And as we move forward in addressing the COVID-19 crisis, I believe it's critical to address the needs of domestic violence survivors and intimate partner violence. This includes also the LGBTQ community. The conditions which lead to domestic violence are isolation, unemployment, stress, and fear, and even more prevalent as we work to contain COVID-19. I recognize the safer at home orders, staying home unless you have an essential trip, like going to the grocery store. I know it's not easy. It is tough. However, it's especially difficult and could be dangerous for people enduring domestic violence. Not everyone is safer at home, particularly those enduring domestic violence. I want to make sure those in the dangerous situation continue to seek help, especially during this pandemic. We're extremely grateful to domestic violence agencies that continue to step up to ensure that the services are available to those in need 24 hours a day, 7 days a week. Domestic violence shelters remain open, and agencies are providing the needed support and services and information remotely. If you need to connect to a domestic violence agency, please call the LA County hotline number 800-978-3600. Nonprofit, no-cost domestic violence legal services also remain available remotely, and courts are continuing to issue domestic violence restraining orders when needed. Information about resources is available on the county's Domestic Violence Council website. You can go on publichealth.lacounty.gov/DVCouncil. The county continues to address the needs of survivors and remains in constant contact with the community to ensure a coordinated and strong response. We know the opportunities to reach out for help can be limited. To help address this, we call on our friends, our family members, and our colleagues to keep in touch with those who may be at risk. If you are uncertain about how to reach out to someone who may be being abused, call a domestic violence hotline to seek that guidance. Consider creating a safe word that a survivor can use to signal you if you need help. Importantly, if you feel that you are at risk of becoming abused, call the National Domestic Hotline Violence number at 1-877-799-SAFE, SAFE, or 7233. Lastly, I just want to take a moment to applaud Governor Gavin Newsom for his initiative to recruit health professionals to prepare for an increase in the number of people who need health care during this time. At healthcorps.ca.gov, you can learn more about the urgent healthcare staffing needs to treat those who are impacted by COVID-19. We need physicians, nurses, paramedics, medical assistants, and even those students that are preparing themselves to get into healthcare arenas. We need you. We need you now more than ever. Go on healthcorps.ca.gov. With that, I'm pleased now to introduce Dr. Barbara Ferrer, our Director for the Department of Public Health.
Good afternoon, everyone. Thank you so much, Supervisor Solis and Supervisor Barger, and the entire Board of Supervisors. As always, they are a positive guiding light for all of us who live and work in this county, and we're very grateful for their service and their dedication to making sure that we do what's best for the health and safety of all Angelinos. I also want to again acknowledge and thank all the leaders across the county who are working so hard together collaboratively, both across the public and the private sector, to make sure that we're taking those actions that are most appropriate for slowing the spread. And today I want to give a special thanks and shout out to all the essential workers who keep our lights on, make sure the water is flowing, make sure our networks are operational, and really are providing critical services that are keeping people alive and well. So we owe them a debt of gratitude, and I hope you join me in appreciating the fact that they are out there taking a risk every single day to make sure that the rest of us have what we need to continue to be able to survive. I'm really sad today to report an additional 10 deaths. I want to note that it's particularly difficult today to acknowledge that 4 of the people who died were under the age of 65. One person who died was under the age of 41. And that while the majority of people who are passing do in fact have underlying health conditions, they all don't, which is a reminder of the ferociousness of this virus. I also want to acknowledge that one of the deaths we reported yesterday, upon further investigation today, was the death of a healthcare worker who was over the age of 60. This is the first healthcare worker in LA County that we know of that's passed from COVID-19. This is bringing the total number of deaths in our county to 54, and our mortality rate remains at 1.8%. Again, slightly higher than the United States, but really on par for many of the other larger jurisdictions. 87% of folks who were positive for COVID-19 and passed away did have some underlying health conditions. But as our numbers grow, so do the numbers of people that actually present themselves as being in good health. And as I've acknowledged every day, this is a hard part of our day at the department, and because these aren't just numbers, these are real people, and they're being mourned today by their families and their friends. We're all deeply sorry for your loss, and we're going to keep you every day in our own thoughts and prayers. And to the family of the healthcare worker who died from COVID-19, I want to express on behalf of the entire county family our sympathy to your family and our gratitude to this person who gave everything for the health of our community. To all the healthcare workers and essential workers, we thank you and we bless you. Today, we're also reporting 548 new cases. Over the last 48 hours, we've had 890 new cases, and the total number of cases now in LA County stands at over 3,011. This includes 115 cases reported by our partners in the city of Long Beach, and 25 cases reported by the city of Pasadena. Last Wednesday, our case count was 799. With today's count of over 3,000 cases, we have more than tripled the number of positive cases here in LA County in a week. This is in part a reflection of the increased testing capacity. Last Wednesday, we reported that there were slightly over 6,000 people who had been tested, and today we're reporting that over 19,000 people have been testing. Also a tripling of the number of folks that are being tested here across the county. And thanks and appreciation to Dr. Ghassan for all of his efforts to make that possible. So the increase does in fact reflect the capacity to do more testing and allow us to identify more people who are positive for COVID-19. But it also reflects, as I've noted in the past, if there are more infected people, then there's a greater possibility of them infecting others. So important that we remember our obligation to neither infect another person or allow another person to infect us. 79% of all positive cases are occurring among people between the ages of 18 and 65, and this has been consistent since we've been keeping track of the numbers at the very beginning, which again means that a lot of folks that are infected may not in fact experience serious and debilitating disease, but they are capable of infecting others. Of all the cases we're reporting to date, 594 people at some point were hospitalized who were COVID-19 positive, which again remains at about 20% of all of the positive cases. Of the 267 people that are currently hospitalized, 173, the vast majority, are 55 years of age and older, and 45% are over the age of 65. However, I do want to note that COVID-19 causes serious disease in all age groups, and we have people who are hospitalized across all ages. Of those people who are currently hospitalized, about 25%, a quarter of all cases, are in the ICU. 34% of those people who are in the ICU are 65 and older, and the vast majority have underlying health conditions. But I want to note that 6 people who are in the ICU today are under the age of 35. You can see our update on cases on the Department of Public Health's website, www.publichealth.lacounty.gov. Every day I'm also going to try to update everyone on the number of cases we're investigating in institutional settings. So we have currently 35 ongoing investigations at institutional settings, where there's at least one confirmed case of COVID-19. 20 of these sites are nursing homes or skilled nursing facilities, and there is one interim housing facility or shelter where we have an ongoing investigation. The total number of confirmed cases across all the institutional settings is 155, and this includes both staff and residents. There are over 11 facilities that have reported 3 or more confirmed cases, and you again can go to our website to have a list of facilities where we've noted that there's an outbreak. Now, we work with every single facility that has at least one positive case on making sure that they have all the tools that they need to do their best to protect the health of the residents and the staff. Many of the residents in institutional settings where we identify a positive case are in fact quarantined, and I ask everyone to be mindful of the restrictions at these sites that insist that there are no visitors allowed. As I noted earlier, as of yesterday, we tested over 19,300 people in LA County. About 12% were positive. So I want to note earlier when we started reporting on positive cases around testing results, we were at about 10%. So we are seeing an increase now in the number of positive cases that are being identified. And I think this again reflects the growing spread of positive people among our residents. And Dr. Kazan, I know, is going to give some more updates around testing capacity, but I want to note that we reported 4,000 more people got tested between Monday and yesterday, which again is a significant increase, and it's thanks to the hard work led by Dr. Kazan and his team. I do want to remind folks that while testing capacity has increased, we currently still have some long wait times, and there still are limits as to what's possible. So testing remains a clinical decision by a provider in consultation with a patient as to whether it's appropriate, medically appropriate for a person to be tested, and lab orders can be issued where it's appropriate for someone to get tested for COVID-19. This ensures that we still are able to have capacity to test those most in need of testing because it helps determine their medical treatment. I want to give a little bit of information about some new guidance that we received this morning from the Centers for Disease Control and Prevention, CDC, that's sort of the National Public Health Department. And they issued some new guidance to define close contacts of people who are positive cases. And remember that close contacts are those people, they're family members, caregivers, they're also people who you may work with whom you've been in close contact with less than 6 feet apart for a prolonged period of time. That often is as little as 10 minutes. But all of those close contacts are notified by a case that they need to quarantine. So it's important to understand this new clarification by CDC on who needs to be counted as a close contact. So in the past, a close contact was somebody who came in contact with a case while the case was symptomatic. So I got sick, I had symptoms, a whole bunch of you were around me the day I had symptoms, we worked really closely together, or we lived together, you're all my close contacts. CDC has changed the definition to acknowledge that you're a close contact if you have had contact with a positive or presumed positive person within 48 hours of that person beginning to experience symptoms. So now if I find out I'm positive today, I have to look back for 48 hours on who was in contact with me even before I had any symptoms, and make sure I notify all of those folks because they now need to go ahead and self-quarantine because they too are considered a close contact. I want to say this is in recognition of emerging science that suggests that there are a certain number of people who, before they become symptomatic, are in fact infecting others. So they may in fact at some point develop symptoms, but it's now acknowledged in some, by some well-known science and research studies that there in fact is the possibility for people to infect other people before they show any signs of symptoms. And that's why we're now going back 48 hours from the time somebody has some symptoms to identify what may be the close contacts of a person who is positive and or presumed positive. So I want to remind folks, I talked about this earlier this week because everyone doesn't get tested. It's important to note that if a provider has said to you, you're not going to get tested, but you have all the symptoms of someone with COVID-19, you should act as if you are positive for COVID-19. That person has the same restrictions on them and the same obligations to notify close contacts as the person with a positive test result. I know this is complicated. We'll be posting guidance on our website later today so that hopefully if you have questions, our guidance will help you better understand what your responsibilities are, both if you're a person who tests positive, is presumed to be positive for COVID-19, or you're a person who was a close contact of somebody who has tested positive or is presumed to be positive for COVID-19. Healthcare workers and first responders have their own guidance that really sets forth the conditions under which they're isolated and quarantined. So I want to make sure to note that this is guidance for community residents, does not include healthcare workers and first responders. As things change, I think it's very easy right now to feel frightened, confused, and overwhelmed. And for folks who have lost their jobs and they had to take on additional responsibilities for taking care of children, taking care of their elderly parents, I can even imagine how much distress this must be causing. And I know that while all of the measures we are asking you to take are for our collective safety and the safety of those we love, I do know that many have made enormous sacrifices on behalf of the collective good, and I appreciate that, and I thank you from the bottom of my heart. The most important step to take right now is to still stay home. Practice your social distancing, only go out for essential services, self-isolate if you're sick, self-isolate if you're positive for COVID-19, self-isolate if you're presumed to be positive for COVID-19. And now you need to self-quarantine if someone close to you or you had close contact with is themselves positive or may be positive for COVID-19. As a reminder, we all need to help each other take care of our emotional well-being, stay connected to the people you care about and who care about you. Phones and new technology allow us amazing access to spending time together from afar. But if you're feeling overwhelmed and you're stressed and you need to speak to someone, you can call the LA County Department of Mental Health Access Center 24/7. Their helpline number is 800-854-7771. That's 800-854-7771. Keep hope, stay diligent. I know that the actions we're taking are the most powerful tools we have in our toolbox for slowing the spread of COVID-19. And I'd now like to welcome Chief Osby from LA County's Fire Department.
Good afternoon, and thank you, Dr. Ferrer. Darrell Osby, Fire Chief of the Los Angeles County Fire Department. And first, before I get started with my speaking points, to the citizens in the County of Los Angeles that have been impacted by the coronavirus, on behalf of the members of the Los Angeles County Fire Department, our condolences and prayers go out to those families and friends and victims that have been impacted. As it pertains to the Los Angeles County Fire Department, our firefighters and lifeguards and paramedics, they train each and every day as it relates to their skill sets. And we have a motto when we train in our department, and that motto is train as though your life depends on it. Because in many instances, as it relates to my profession, as it pertains to our training, your life does depend on it. So when you hear people say that we're trying to do things to flatten the curve or social distancing or stay at home, that really applies to what we do in the fire service. Because when we ask you to do that, in many instances, your life depends on those characteristics. So it's important that you implement those characteristics each and every day as we fight this coronavirus. I'm here today to tell you that the number one mission of our department still remains the safety, the welfare of the communities that we serve. I want to let you know that that's our top priority. As a regional coordinator, I've had the opportunity to speak to all 30 departments, fire departments in the County of Los Angeles, to ensure that they share that same vision. We've updated our emergency response plans. We have contingency plans in relation to trigger points, to ensuring that if this progresses in the fire profession, that we will do things across borders to ensure that we have a regional response to continuously ensure the safety and welfare of the citizens in the County of Los Angeles. This Saturday, I had an opportunity to talk to the members of my department via video and then in some instances, phone call. But the video was an opportunity to relay what the Board of Supervisors, my peers, myself, and others are doing in relation to their safety. And it was an opportunity to reemphasize our commitment as it relates to public safety. Afterwards, I had an opportunity to speak to some of our first responders. One particular captain in particular talked to me about his experiences, how they feel, the anxiety that they have in relation to where they are. But at no point did their commitment and their responsibility as it pertains to our mission has wavered. But in that, you can tell that there are concerns in relation to our first responders and then their families. As this COVID-19 has progressed from source patients to community spread, it's important that we remember all the characteristics to keep our first responders safe and our families safe. During the month of March, my department responded in over 1,070 calls. Of that, 1,070 calls per day. Of that, approximately 250 of those are coded as potentially having COVID-19 based on the call type. As our data and information has progressed and gotten better, through our data, our firefighters and paramedics are able to capture better data. And from that, in the month of March, they were able to articulate and share that approximately 1,175 patients, contacts they had, potentially had the signs and symptoms of COVID-19, but weren't tested for COVID-19. Over the last 3 days, there have been 82 instances, 62 another day, and then 104 yesterday in relation to those contacts. Currently, in my department, 10 firefighters have tested positive for COVID-19. Of those 10, 7 have recovered and returned back to work. The other 3 are still in isolation, but they're doing well. I'd like to thank everyone for their well wishes in relation to their state of being. Our department has done a lot in relation to ensuring our first responders are safe. We test their vitals each and every day and throughout the day to ensure that they're safe amongst themselves. In addition to that, we have peer support and mental health through our health programs office to ensure that we're providing the appropriate support for our firefighters, lifeguards, dispatchers, and critical employees. In conclusion, a couple of things. Our department has implemented a telemedicine program for our paramedics, which means on their computers, when they're on calls, they can communicate with nurse educators or physicians to make additional determinations as far as field treatment. In some instances that allows us not to take our people or patients to the hospital unnecessarily. Also, my department has been received a grant from the Quality and Productivity Commission that will soon allow us to triple that capacity to all our units to allow us to talk through telemedicine to our nurse practitioners and physicians. The Los Angeles County Fire Department has several incident management teams and subject matter experts assisting the county via the logistics with health supplies, medical shelters, housing, the county EOC, and also countywide testing. So I'd like to bring to the podium next the Medical Director of the Los Angeles County Fire Department, Dr. Clayton Kazan, to expand upon his efforts as it relates to COVID-19 testing.
Thank you, Chief Osby, and good afternoon. I know that this is a stressful time for all of us. We're all thinking about our health and that of our loved ones. What Dr. Ferrer relayed in terms of the healthcare worker fatality weighs especially hard on me as well, because I'm a healthcare worker, I'm a physician. I've been in healthcare for the past 26 years, and I want to relay some really good news. Over the last couple of months, I have never witnessed anything close to the level of collaboration that we've seen across healthcare organizations, governmental organizations, really everyone banding together for this coronavirus pandemic, and that to me has been extremely reassuring. In particular, I want to thank the Board of Supervisors and their deputies and the CEO and her office for stepping up, purchasing kits for us, purchasing lab capacity, sharing their stakeholder contacts around the community, without which we would not have been able to gain the traction that I get to come up and announce today. There's been an unbelievable amount of work that's been done in a very short time frame. From the City of LA, I'd like to express my gratitude to the City Council, to the Mayor's office, and also to my counterpart at the City, Dr. Mark Eckstein. They've done some amazing work to get the first mobile testing centers up and running, and they're now processing more than 1,000 specimens a day. Those sites are open 7 days a week, and you can register for a time slot at one of the centers at coronavirus.lacity.org. I'm pleased to announce that the city and county efforts to deliver widespread access to coronavirus testing are now merging. The sites that we're bringing online will be accessible via the established website. And as more centers join the effort and more capacity is available, we'll continue to add them to the website so that residents can access all of the public testing sites from a single web page. Over the last 10 days, we've established partnerships all across the region. Beginning tomorrow, April 1st, in partnership with Supervisor Barger's office, High Desert Medical Group, and the City of Lancaster, we'll be launching a mobile testing site at the High Desert Medical Group office on 15th Street West in Lancaster. Also in partnership with Dignity Health, we'll be launching a testing center on the campus of Glendale Memorial Hospital, and we hope to get one launched very soon at Northridge Hospital Medical Center campus. The county incident management teams that the fire chief referenced are working to establish 3 additional sites that we hope to launch before the end of the week. The first one is at the South Bay Galleria in Redondo Beach, which will be a partnership with the Galleria, the Beach Cities Health District, Providence Medical Institute, and the California Office of Emergency Services. Another one will be at the Antelope Valley Mall in Palmdale, a partnership with the local medical centers in the area, Palmdale Regional Medical Center and Antelope Valley Hospital. And we're also looking to launch at the Pomona Fairplex in a partnership with Pomona Valley Hospital. We're also in discussion with stakeholders in hopes of launching a site at the Rose Bowl supported by Huntington Memorial Hospital, the Pasadena Fire Department, the Pasadena Department of Public Health, and the City of Pasadena. And we're in discussion with the Long Beach Department of Public Health to help them scale up their operation. In keeping with our mission to ensure that first responders have access to testing, we're working on a plan that we hope to make live by the end of the week that will enable police, fire, and EMS departments from across the county to get access to test their own personnel. The Sheriff's Department and LA County Fire are already live. We've worked extensively together, and we believe that it's a scalable model. Lastly, we've been working with Housing for Health to support their work at the Union Rescue Mission and at Dockweiler Beach, and supplied them with testing kits yesterday. In conclusion, I know that the limited access to testing has been a big source of frustration for our community as a whole. Please know that our teams at the city and the county are working diligently and collaboratively to open up access as quickly as possible. As new sites open up, they will be added to the website again, that's at coronavirus.lacity.org. At this time, I'd like to hand the podium off to Sheriff Villanueva.
Good afternoon. First of all, I want to thank all of our first responders, our deputies, our custody assistants, security officers, all of our professional staff, all of our healthcare workers, everyone who's manning the front lines out there in the medical field, in the public safety for the work that's been done to date and the work that's yet to come. And I also want to thank the media for the opportunity to get all this information out. Now, like you, I've witnessed parts of the world where COVID has hit so hard, it has led to a shortage of medical staff capable of managing ICU equipment to help treat COVID patients. Retired nurses and doctors are coming forward to help. These individuals are putting their health at risk to help others, and we need to match those heroic actions as best we can. I'm inspired by these people who are willing to put their lives on the line for others, just the way our first responders do every day. And as such, we have identified for our own LASD family individuals who are EMTs, emergency medical technicians, and licensed paramedics to assist in the event that we need to start working on supplanting our healthcare providers who are becoming affected with the virus. So we have 253 licensed EMTs and 17 licensed paramedics available in the case we get to that point. And again, we're all in this fight together, and we all need to chip in. Now, let me transition to what is happening in our patrol. Presently, we have, actually the entire department, we have 7 of our employees who are now affected by the virus, 5 sworn, 2 civilian. We have 49 that are under medical quarantine and 102 under self-imposed quarantine. We have provided all of the necessary personal protective equipment, the gloves, masks, the shields, everything that is necessary for those that are out in the field. We're screening our calls, and we're hoping these number remains as low as possible. But NYPD just lost 4 officers to the coronavirus. And I want to extend our condolences to their families and to all 5,000 of NYPD who are currently afflicted with the virus while they're carrying out the very admirable job they're doing there in some very trying times. So our response, we have been able to beef up our patrols. In fact, our average daily assignment in patrol fluctuates around 250 to 300 what we call radio cars. Those are the black and white radio cars you see around there. They're manned by either 1 or 2 person units. Now we're up to 852 of them right now out in the field. So that's over 1,700 deputies in the field, beefing up our presence, our visible presence in all the areas that we've designated, and assisting with the overall mission. And we're reaching out in terms of providing security for all the shelters, all the medical places that are being set up now that has no security. Now we're providing that security as well. At the same time, we're reaching out and we're keeping track of all the places that are now vacant that are an attractive sitting target for the criminal community, and we'll be waiting for them. And we're also reaching out in all our patrol areas for people that are homebound, the disabled, the handicapped, to make sure we keep track of them and they're not left behind in the shuffle. And last but not least, I want to briefly address the board motion that passed this morning. Since the Sheriff's Department is no longer responsible for the emergency management operation of this crisis, our personnel who are currently at the County Emergency Operations Center are going to remain there. The ball is in play, and we're not going to let the ball drop at any time. When the Board of Supervisors develops a transition plan, we're more than willing to start replacing our personnel with their personnel as appropriate, and so we'll be waiting for them. But I want to reassure the public that we're not going to drop the ball. Our job is to provide public safety, and that remains our #1 priority. And so anyway, that concludes this part of the process, and now we want to turn over to Stacy for Q&A with the media.
Thank you, ladies and gentlemen. If you wish to ask a question, please press 1, then 0 on your touchtone phone, and you may withdraw your question by repeating the 1-0 command. So once again, if you have a question, please press 1, then 0. And we'll go to Phil Schuman with Fox 11 News. Please go ahead.
Hi, this is a question for Supervisor Barger. Given the current crisis, did you reconsider the timing of the motion to reorganize emergency services? And if not, how will this impact public safety right now?
Thank you for that question, and I think the sheriff just answered that in terms of the fact that he continues to have people over there. There will be no change in how we are operating as it relates to the coronavirus, and I think we all agree, both the sheriff and the board, that we are putting the lives of our constituents first, working with Dr. Ferrer as a public health issue. So I'm confident that the public is going to see no different in how we are responding to this crisis.
But why now? Do you acknowledge that the timing of it
No, I mean,
potentially look awkward?
from an optic standpoint, I understand that, Phil, but from the standpoint that this began in November as a result of the Woolsey fire, this board has been consistent, and Supervisor Kuehl, and I would encourage you to get her remarks today at the board meeting, pretty much outlined how this all came to play. There's no question from an optic standpoint, the timing is not the best, but from the standpoint of public safety and the impact it's going to have as it relates to how we are responding to this, I'm confident that there will be no change in how we are working together to address that. So next question.
Thank you.
Thank you.
We'll go to Carlos Granda with Channel 7 Eyewitness News. Please go ahead.
Yes, this is for Dr. Ferrer. Regarding the skilled nursing facilities, we spoke to one this morning that they had 4 deaths, 11 positive employees, 8 residents that are hospitalized positive. These places obviously have a lot of people close together. What can you do to proactively slow this down? Because it seems like these nursing facilities are going to, it's going to run rampant unless something is done proactively.
Thanks so much for that question. I do want to note that we had our teams out the last month working with all congregate living providers, both shelters, nursing homes, long-term care facilities, to really help them put in place practices around both infection control, making sure they have capacity for isolation and quarantine, and knowing that our team is here to support them and help them. You're absolutely right. When people are living in congregate living situations, it's a lot easier for there to be spread. We feel pretty confident that, like everywhere in our community, it's impossible to completely keep out the virus. One of the reasons we've gone to having no visitors at any of these sites is because the risk of visitors bringing in unintentionally COVID-19. We're also asking at every site that all of the employees have to do an active check on their own physical status. They need to make sure that they're not running fevers. They need to make sure that they have no symptoms. The problem is, as you've noted, that people can be infectious without showing signs of carrying the virus. So it really means that we rely heavily then on infection control practices at each of the institutions, and the same social distancing we require outside in public spaces and in your homes are what we need to have happen in our institutions. And then when there is a positive case, we're in there as soon as we're notified that there's a positive case, so that we can in fact make sure that all close contacts are quarantined, that people who are positive have an isolated room so that they can't continue to transmit the infection. And we particularly spend a lot of time making sure that staff aren't, able to easily transmit in those settings. I think I want to give a lot of credit to the nursing home managers and the staff, because I think they're doing their very best under what you note is a difficult situation. Most people who are in these facilities need the care that's provided in these facilities. And again, the frontline workers need to do their very best and have our support for doing their very best. And we'll go on to the next question.
And we'll go to Carla Hall with LA Times. Please go ahead.
Hi, Dr. Ferrer. Yesterday the city of LA suspended all farmers markets in the city. Does the county have any, or the Department of Public Health have any plans to do the same until farmers markets can prove that they are safe places to gather? Or are you going to issue any kind of guidance on farmers markets? And then secondly, you mentioned that there was a case you're investigating in a homeless shelter. Can you say where that is?
So let me go to the first around the farmers markets, because I think it's a critically important issue. We actually at the Department of Public Health, through our Inspectional Services Division, we actually license all of the farmers markets, permit all of the farmers markets. And we have had our inspectors out and about at the farmers markets trying to help them make the same modifications you're seeing at grocery stores so that these can be places that are safe for folks to shop and really get essential groceries. We want to also support our farmers. But the situation has to change so that at every farmer's market, you're able to see the kind of social distancing that makes it safe for both the people who are selling and for the people who are buying. So we'll be out and about again this weekend with our inspectors, making sure that people are doing, implementing our guidance. We will be modifying our guidance. It should be up on our website to make it clear what the strategies are for accomplishing significant social distancing. I think the mayor was right to note that unless that can happen and we can run these sites safely, then it's not appropriate. So as with everything else, we want to work with all of the vendors to make these sites appropriate, but we also know that we have an obligation to protect everyone's health and well-being. So we'll take, and the second question was about what was happening with the shelter.
You said that there's an investigation?
We have a positive case in an employee in one of the shelters. I'm not exactly sure at the moment what the name is of that shelter, but we're doing a complete investigation, and I know that we'll be quarantining close contacts who may have had an exposure at that shelter. But thank you.
Is it in the city of LA or?
I would have to get back to you. I just don't have that information right now. I just have sort of the summary of the institutional investigations. But we can get back to you on that. And I know it looks like there's time for one more question.
And we'll go to Stephanie Dazio with Associated Press.
Hi, thanks so much for doing this. We appreciate it. We're a little confused about the testing and how rapidly it's increasing. 8 days ago, a councilman said that he expected 5,000 tests to be administered and processed locally by last Friday. You mentioned today something about 1,000 tests. What's going on here with that?
The number is 19,000 tests.
Okay. So the question was to the number of tests that are being performed. I can tell you that the City of Los Angeles sites that they have put up over the last week have done about 10,000 tests. They have 4 sites up and running. They're working on getting a 5th. Realize that there are also clinics that are sending off their tests to Quest, LabCorp, and other national labs. Some hospitals have been able to get their labs up and running. So hospital systems like UCLA, Cedars-Sinai, Kaiser Permanente, and there are others around the area that are able to do their own tests. So I don't have access to all the tests that are done, but they're being done from a lot of different points. Did that answer the question?
I think so. What's the ideal? What are you trying to ramp up to?
We've set a goal for ourselves to get, in terms of the public access to testing, up at around 10,000 tests per day. Right now, we are probably all in about 1,500 a day.
And how long is it going to take to get from 1,500 to 10,000? That's not a small leap.
No, it's not. But as we bring more centers up, if the average center that's running efficiently can do 250 tests a day, scaling them up around the county and getting as many as 5 or 6 more up even just this week, it's a goal. I think we can get there.
By when?
I'm working as hard as I possibly can. I should have several sites up this week, and I'm just trying to knock them out one at a time.
Great. Thank you so much, sir. We appreciate it.
Okay.
Buenas tardes, mi nombre es Hilda Solís, soy la supervisora del Distrito Número 1 y solamente hoy día quiero dar las gracias a todos que están con nosotros, pues oyendo la tema de tener estrictamente atención a los órdenes de salud público, que deberían de quedarse en sus casas lo más posible y también tener distancia dentro de las personas donde vivimos o si vamos a las tiendas o lo que sea, tienen que pensarlo bien. Pero también en este momento quiere decir que mucha gente tiene muchas horas de sentar en sus casas, pero quiere decir que hay gente buena que nos están ayudando en otros temas. Por ejemplo, un grupo de mujeres de tercera edad estaban haciendo máscaras para los empleados del condado. Pueden usar su tiempo haciendo cosas buenas para nuestra comunidad. Y yo quiero decir que me da bastante gusto a saber que hay gente así que están cooperando con nosotros. Pero también estoy muy preocupada yo del tema que sabes que muchas veces no hablamos francamente. Y eso quiere ser el tema de la violencia doméstica. En este tema es tan importante porque hay muchos que están impactados. Por ejemplo, tienen mucho estrés las familias, desempleo o tienen miedo porque las condiciones no son constantes. Deberíamos de saber que hay ayuda para nuestras personas, especialmente si alguna persona vive en una casa donde es una víctima o víctimas de la violencia doméstica. Y quiero también decir que las comunidades de LGBTQ también, si enfrentan violencia, nosotros tenemos grupos que les pueden ayudar. Tenemos también oficinas que están abiertas 24 horas al día, 7 días a la semana, y pueden llamar a este número, todos, 800-978-3600, 800-978-3600. También quiero dar las gracias en este momento al gobernador Gavin Newsom, que ahorita nos está apoyando diciendo que quiere ver más personas dando su servicio profesionales en la área de salud médica. Necesitamos saber si hay personas que nos quieren ayudar. Mejor hay personas en sus casas ahorita que son doctores, enfermeras, asistentes médicos y estudiantes que todavía no cumplen con sus certificados o licencias, pero hay manera donde pueden ayudar al condado de Los Ángeles. Por favor, si quieren más información, vayan a la página de healthcorps.california.gov, healthcorps.california.gov. En este momento me da un honor a presentar a la directora de Salud Pública, la doctora Barbara Ferrer.
Buenas tardes a todos y muchas gracias a la supervisora Solís y la supervisora Barger y toda la Junta de Supervisoras por todo lo que están haciendo por el condado de Los Ángeles. Su liderazgo ha seguido siendo lo más importante para el condado y me da un placer estar trabajando con gente que tienen centrado al trabajo que tenemos que hacer para que toda la gente aquí tiene la salud y la seguridad que necesitan para una vivienda propia. También quiero agradecer a todos nuestros otros líderes en todo el condado de Los Ángeles. Este trabajo ha requerido por parte de todos unas acciones de colaboración. Todos ustedes son verdaderamente fenomenales. Para actualizarlo sobre nuestro estado actual, estamos bien tristes a reportar 10 más muertes adicionales hoy en el condado. La mayoría de estas personas tenían serias condiciones de salud, pero todavía estamos aquí con sus familias y con nuestras oraciones por las pérdidas que han sufrido. Esto eleva el número total de muertes a 54 en el condado de Los Ángeles y nuestra tasa de mortalidad por COVID-19 es de 1.8%. Eso no ha cambiado desde el principio. Si bien debemos informar estos números todos los días, pero no se trata solo de las estadísticas. Estas son personas reales a los que hoy lloran sus familiares y sus amigos y lamentamos profundamente su pérdida y las mantenemos en nuestros pensamientos y oraciones. También hoy estamos reportando que hay una familia de un trabajador de salud que falleció a causa de COVID-19 y no podemos expresarles nuestra suficiente simpatía y nuestro agradecimiento a esta persona que dio tanto por la salud de esta comunidad. A todos los trabajadores de la salud, gracias. Lo que haces hoy y en todos los días es heroico. Todos le debemos darle una enorme gratitud. Hoy también estamos reportando 548 casos nuevos y el número total de casos en el condado de Los Ángeles ahora es 3,011. Y estos números son duros porque también sabemos que hay muchas personas que están hospitalizados. 594 casos han sido en algún momento hospitalizados y eso es 20% de todos los casos positivos. De los que están hospitalizados actualmente hoy en día, que son 267 personas, la mayoría de esas personas tienen una edad más que 55 años. Pero COVID-19 puede causar enfermedades muy graves en personas de todas las edades. También estamos investigando 35 entornos institucionales que tienen al menos de un caso confirmado de COVID-19. 20 de estos son hogares de ancianos o centros de enfermería especializadas. El total de casos confirmados en todos los entornos institucionales es de 155 y esto incluye tanto el personal como las residentes. Los equipos del Departamento de Salud Pública están trabajando con todos los lugares que tienen un caso positivo y estamos trabajando también con el personal en cada de estos lugares porque ellos quieren hacer todo lo que es posible para proteger a la salud de sus residentes. La mayoría de las residentes en estos lugares están en cuarentena. Quiero hablar por un momento sobre las pruebas. Desde ayer, más de 19,300 personas se habían sometido a pruebas en el condado de Los Ángeles y el 12% de estas personas fueron positivas. Muchas gracias al doctor Kazan y a todo el equipo que están trabajando duro para que podamos aumentar la capacidad de prueba en estas semanas que vienen. Por lo tanto, sigue siendo crucial priorizar a ciertas personas para las pruebas. Y esas son las personas que tienen síntomas y que un médico ha determinado que son apropiados para las pruebas. Por favor, mantenga la paciencia con nosotros porque es bien importante que estas personas se puedan sacar las pruebas. Y quiero terminar con unas gracias a todos ustedes. Yo sé que a medida que las cosas están cambiando, es fácil sentirse asustada, confundidos y abrumados. Aunque que todas estas medidas que pedimos son para la seguridad de usted, sus seres queridos y a toda nuestra comunidad, yo sé que son bien difíciles. Y aunque todos nosotros tenemos que hacer nuestra parte, para mucha gente esto es bien difícil. Recuérdate que tienes que cuidarte a ti y a los que están en tu familia y también a la salud mental de todos los que están alrededor. Manténganse conectados con las personas que le importan y que se preocupan por usted. Los teléfonos y las nuevas tecnologías nos permitan un acceso increíble para pasar tiempo juntos desde lejos. Si necesitan ayuda por el estrés, están estresados o abrumados, por favor llama 24 horas al día, 7 días a la semana, el Centro de Acceso del Departamento de Salud Mental del Condado de Los Ángeles. Ese número es 800-854-7771. Manténganse la esperanza y sea diligente. Las acciones que estamos tomando son las más poderosas para que nosotros podamos frenar la propagación de COVID-19. Muchas gracias y ahora estoy invitando al Sheriff Villanueva para hablar. ¿No? Oh, discúlpame, ahora estoy llamando al señor Narváez del Departamento de Bomberos del Condado. Disculpa.
Hola, buenas tardes. De parte de los bomberos del Condado de Los Ángeles, queremos ofrecer nuestros más sinceros pensamientos a las familias que perdieron seres queridos. Hoy quiero dar el mensaje que da el jefe de bomberos del Condado de Los Ángeles, que primero, lo más importante para nosotros es la salud, seguridad y bienestar de nuestras comunidades y sus residentes, continuar siendo la prioridad de nosotros, Departamento de Bomberos. Estamos aquí para asegurar a cada uno de ustedes que los bomberos, paramédicos y salvavidas del Departamento de Bomberos del Condado de Los Ángeles continuar su misión de asistir y salvar vidas en nuestras comunidades. El jefe quiere decir que este pasado sábado tuvo la oportunidad de estar con los bomberos de nuestras comunidades y los paramédicos por su compromiso y darle las gracias por su compromiso y dedicación y su continuar tarea de asegurar que nuestros servicios siguieran disponibles 24 horas al día, 7 días a la semana, sin ningún tardanza o interrupción. Durante el mes de marzo, el Departamento de Bomberos atendió a unos aproximadamente 1,070 llamadas al día. De esos, 250 fueron aproximadamente clasificados bajo categoría de sospechosa de coronavirus. Con eso, el departamento va asegurando que los paramédicos que asisten a esos pacientes van listos y preparados. En este momento tenemos los bomberos del Condado de Los Ángeles, 3 bomberos que tienen el virus y teníamos 10, pero 7 de ellos ya recuperaron. Lo más importante es asegurar que las familias de los bomberos se estén fijando que nosotros le estamos dando todo lo humano que podíamos. Bajo la guía de nuestro médico, Dr. Kazan, continuamos asegurando que nuestro personal tenga acceso y prioridad a los estudios. Con eso lo quiero presentar el alguacil del Condado de Los Ángeles, Alex Villanueva.
Buenas tardes a todos. Primero quiero dar las gracias a todos los primeros respondientes, todos los que están trabajando como doctores, enfermeros, enfermeras y toda la salud pública, toda la profesión de medicina y los que están trabajando como bomberos, como policías, alguaciles a través de todo el condado. Todos están trabajando muy fuertemente, luchando día tras día para mantener la seguridad y la salud de todos. Y a los del departamento mío, los alguaciles, los asistentes de custodia, los oficiales de seguridad, le quiero dar las gracias a ellos también. Y a los medios noticieros también por poder informar al público lo que está ocurriendo con el el pandémico del virus de corona y que sigue manteniendo al público informado. Bueno, hemos visto a través de todo el mundo, en particular en Italia y ahora en la ciudad de Nueva York, como el avance del virus y el pandémico ha causado muchos problemas y ha resultado en personas de la profesión médica estar entonces infectados con el virus, y eso crea muchos problemas en cuanto a poder ofrecerle todos los servicios médicos a las víctimas del virus. Y nosotros hemos podido recurrido a enfermeros, enfermeras, doctores que ya se han jubilado y buscando voluntarios para que vuelvan a la profesión y ayudar en este momento de crisis. Y le extendemos las gracias. Y lo mismo dentro del departamento de nosotros, tenemos técnicos de medicina de emergencia y también tenemos paramédicos. Tenemos 17 paramédicos licenciados, tenemos 253 técnicos de medicina de emergencia y disponibles y listos para poder voluntariar sus servicios a este esfuerzo si es necesario llegar a este punto. Y es bueno saber que todos estamos trabajando juntos para ese propósito. Entonces, en el área de patrullaje o en todo el departamento hemos tenido 7 miembros que están infectados por el virus. Todos están en buenas condiciones en este momento y rezamos que van a seguir adelante y recobran su salud. Y hemos tenido a 49 bajo cuarentena médica y 102 que están bajo cuarentena o aislados ellos mismos. Todos están recibiendo todo lo que necesitan en cuanto a recursos médicos, y todos los que están trabajando en las calles, los que están trabajando en las cárceles, están recibiendo todo el equipo que necesitan para poder hacer su trabajo sin el peligro de ser afectados ellos mismos por el virus. Y por razón y queremos darle también el pésame al Departamento de Policía de la Ciudad de Nueva York, que 4 de sus oficiales murieron hoy en día por causa del virus, y le extendemos la condolencia a ellos y el pésame a toda su familia en este momento. Entonces, hemos aumentado los patrullajes en las calles. Tenemos un promedio de 250 a 300 en cada día normal durante el día. Y ahora, hoy mismo, en este mismo momento, hay más de 850 unidades en la calle trabajando, de 2 personas cada uno. Son casi 1,700 oficiales en las calles ofreciendo el servicio, mucha visibilidad en las áreas de comercio, los supermercados, todas esas áreas donde puede haber un conflicto por una escasez real o imaginaria. Y también están haciendo patrullaje en las áreas que están abandonados o cerrados porque los negocios cerraron para que nadie los robe. Y a la misma vez estamos pendientes de todos los que están viviendo solo en su casa, los que tienen los de la tercera edad, los que están en silla de rueda, los que tienen cualquier impedimento, que no pueden asistir a su propio quehaceres personales, y estamos extendiendo la mano para mantener el contacto de ellos en todo momento. Y a la misma vez, por último, quiero darle en cuanto a lo que eligió la Junta de Supervisores esta mañana con respecto a la dirección de operaciones de emergencia del condado, como se va a trasladar esa responsabilidad del Departamento del Alguacil al condado de Los Ángeles en sí. Nosotros siempre vamos a tener una responsabilidad en cuanto a las operaciones de emergencia, y los que están haciendo ese trabajo ahora del departamento de nosotros se van a mantener en pie haciendo ese trabajo. Y cuando los oficiales del condado tengan su plan de traslado de esos poderes y esa responsabilidad, pues entonces en ese momento vamos a hacer el traslado. Pero hasta que eso no se cumpla, no vamos a dejar la pelota caer al suelo, como dicen. Entonces, la seguridad pública sigue siendo mi responsabilidad, mi prioridad, y va a ser la prioridad de todo el gobierno del condado de Los Ángeles. Y no hay preguntas en español, y con esto vamos a cerrar la rueda de prensa. And this concludes our press conference. Thank you.
Okay, Stacy, if you could give me just a second on my end, okay?